Welcome everyone to today's Cultivating Success Small Farms webinar. Today we're going to be talking about best practices for community gardens during this time of COVID-19. The Cultivating Success program is a partnership of University of Idaho Extension, Rural Roots, and Washington State University's Food Systems program. My name is Colette DePhelps. I will be your moderator today. And so at any time, if you need technical assistance, you can put that into the chat. Our speaker today is Stephanie Smith. She is the statewide consumer food safety specialist with Washington State University, and we are really happy to have her on today's webinar. A couple of webinar tips. If you're having any trouble with speed of the slides changing or clarity of sound, it could help to close all of the other programs running on your computer so you can dedicate your bandwidth to this webinar. You do have the option to call in for your sound. If you do that, you'll want to mute your computer when using the phone. Here you will see the call-in numbers that were available to you. Hopefully one of those would be local for you if you are calling in from a landline. Those call-in numbers are also provided in the welcome email that you received. At any time during the webinar, you can type questions for Stephanie into the Q&A box. And if you have any problems with technical assistance, please type those into the chat. My colleague Mackenzie will be moderating the chat for technical issues. I will be watching both the chat and the Q&A box for questions for Stephanie. If you registered for this webinar before 8 a.m. Pacific time today, you've already received via email a PDF copy of the slide handout. If you registered after 8 a.m., you will receive a copy of that handout via email later today. We will also have that handout available as a PDF from the Cultivating Success website, and I will show you exactly where at the end of this webinar. So we already have 375 people participating in today's webinar, and we wanted to do a quick poll to ask you where you're located. So I'm going to go ahead and launch that poll, and you should see an option that you can click where you're located. I see that that's going really rapidly. We already have almost half of the people on the webinar who have let us know where they're located. So I will give this a couple more seconds. We definitely have a lot of people from Washington, Oregon, and Idaho, and several people from other parts of the United States. So I'm just going to give it a couple more seconds because sometimes it takes a minute for people to figure out how to do the voting on this poll. So we have almost 70% of our participants who have voted. So that's over 270 people. Okay, I'm going to go ahead and end the poll and share the results. So as you can see, we have a really large number of people from Washington, about 200 people logging in from Washington, 63 from Oregon, and 35 from Idaho. And then we have several people from the western region of the United States, the North Central, and a couple from even the Northeast and Southern region. Okay, great. So the next slide, I wanted to say we want to thank you for being here, being on the webinar, and it will really be helpful to us as we go through the webinar today to understand how you are involved in community garden. So we have a second poll that I'm launching now. And so let us know if you're, and with this one you can check more than one answer. So if you have more than one role in the garden, please let us know. So are you a gardener? Are you a volunteer, a manager, an advisor, or other? So it's, I believe a couple people are not seeing the poll this time. I'm sorry about that. We do see people, we do have that people are completing the poll, so I'm not sure why that is the case. So since everybody can't see it and it's not working second time around, it might be because of the large number of people that are on the webinar today, maybe the system is a little bit slow. I'm gonna go ahead and end that poll. So I'm sorry that that poll didn't work as well as the other, but from the little bit of results that I do see, we do have a really good mixture of people today, gardeners, volunteers, managers, and advisors. So thank you for those of you that were able to do the poll. Okay, with that, I'm going to go ahead and hand the webinar over to Stephanie.
Thank you. I am just going to get my screen up here.
Okay, great.
Fantastic. Well, I wanted to thank you all for joining us today. This is a very popular webinar, probably the most popular one I've participated in. So I want to thank you all. Hopefully this will be informative and helpful to you all that are working with community gardens. I'm just going to give an overview real quick of what we're going to talk about today. So first, I want to give you some information about what we do know about the COVID-19 disease and the virus, and then talk about some of the concerns and controls that should be put into place in community gardens. And this will include information both on gardeners and visitors, on surface tools and harvest containers, including cleaning, and sanitation practices, and some information about water resources. And then I'm going to talk briefly about some protocols that can be put into place, and then doing training and communication to different, to the public, to the gardeners, and to stakeholders. And then I'll wrap up with some of the take-home messages that I want you all to have, and then I'll be happy to answer any questions. Some questions might be relevant to the different slides that might be relevant to a particular slide. So I'll try to answer those if Colette or Mackenzie can let me know if there's a clarifying question with regard to a slide, and then I can take the majority of the questions at the end of the webinar. Okay, let me see. Okay, so some of the facts on COVID-19. So COVID-19 is the disease that is caused by the virus, and the actual virus name is called SARS-CoV-2. So this is a respiratory virus. It's spread through person-to-person contact via respiratory droplets. So some of the things that you've probably been hearing about in the news and some of the advice that's been given is that it can spread easily between people that are in close contact. So they're advising social distancing of at least 6 feet. And actually, I think there's some concern that, you know, further distance, that may not be enough distance either, you know, that further distances might be better. And then, of course, it's spread through coughing, sneezing. When people are talking, then they're releasing some vapor from their mouth, and you know, that's getting out into the air, and so people close by could potentially breathe that in. And then there's been some discussion lately about whether it can be spread just by somebody breathing close to another person. So that's one thing where they don't have solid data on that yet to know for sure, but that is something that's been discussed recently, that might be a concern. And the other thing that's important to know about the virus is that it may be spread by people who are not showing symptoms. And as the pandemic continues, they're starting to get a lot more information about this and seeing that people might be spreading the virus before they're showing symptoms, and that some people may actually carry the virus and be and remain asymptomatic. On the bright side, the virus is not a foodborne pathogen, so it's extremely unlikely that someone will catch it through consumption of food. So that's the one thing that's good to know and that's helpful information. However, the virus can be spread by touching a contaminated surface and then touching one's mouth, nose, or eyes. This is not the primary method of the virus being spread. Again, it's spread through person-to-person contact, through sneezing, coughing, and just expelling the virus through your nose or your mouth. The virus does not grow on surfaces, but it can survive on surfaces. A recent study showed that it can survive up to 24 hours on cardboard and up to 2 to 3 days on plastic and stainless steel. So even though the risk is a lot lower of someone becoming contaminated from touching a surface and then touching their face, there's still a potential risk. So we're really going to focus on trying to reduce that risk as well. The virus can spread very easily, and it spreads more efficiently than influenza. So that's why it's such a big concern. Also, it's a new virus, so there's still a lot to be learned about the virus and with regard to its transmission, and then also, the number of people that might be asymptomatic and the virus's survival. So we're still in the process of learning all of that. So now I'm going to go on and talk about some of the concerns with community gardens and some of the controls that can be put into place to prevent potential contamination and prevent people from becoming ill while working in the garden. So of course, visitors to the garden may spread the virus to other people. So that's the major concern. Some other issues is that it can be difficult to maintain social distancing that's recommended by the government agencies. And some of the reasons for that are, it might be a small garden, people are working in close quarters. There's a lot of movement throughout the garden to different areas, to either access water or tools. A lot of the resources in the garden might be shared. So again, using different types of buckets, potentially harvesting pails, water faucets, those sorts of things. There may be peak hours where there's a high concentration of people in the garden. And then there's also difficulty with trying to control and manage social distancing within those types of quarters. Some of the controls that should be put into place, we'll discuss those as we go through the next series of slides. But the number one thing that should be done is to postpone all events. At this time, it's unknown when the pandemic will end. There's some estimates that will probably peak over the next month and that things will start to slow down by June and look a lot better, but we really don't know. As they've said, as some of the experts have said, it's really going to be up to the virus and how the virus behaves. They'll determine when the pandemic will end and we'll be able to resume life as we have used to know it. So in the meantime, you really want to limit gardeners to less than 10. That's in part because of state regulations. So different states, of course, have different regulations with regard to people gathering. So most of the states limit it to less than 10 people. So you want to comply with that. You do want to close the garden to the general public. You don't want extra people coming into the garden that you would have to try to manage. It's a good idea to use sign-up sheets for when people will be visiting so that you can have control over the number of people in the garden at any given time. And it's also a good idea to have visitor logs in place so that you know who's coming into the garden and when they're coming in. And you definitely want to enforce social distancing. It's really important to have someone in charge. This can either be volunteers or garden managers, but it's good to have at least one person at the garden that can enforce different controls that are being put into place, make sure protocols are followed, and doing cleaning and sanitation, which we'll talk more about as we proceed with the webinar. So again, whoever's in charge should be managing the gardeners, making sure that visitors are excluded from the gardens, make sure that social distancing protocols are being abided by the people that are working in the garden, make sure that the protocols that you have put into place are being followed. And then, of course, doing the cleaning and sanitation and general maintenance within the garden. So when the garden's open, it's good to have at least one person there the entire time. Even if you have a group of people that are taking different shifts, it's good to have somebody there. With regard to social distancing, it's really important to try to use sectors and schedules. So I have an example of this on this slide of something that you might want to implement. I know that each garden is different, each layout is different. So really, this is just an example of something to consider and to find a way to make it work for your particular garden. So one example is, you might have the first shift, for example, that works from 8 to 10 a.m. Shorter times are always better. So you want to minimize the amount of time spent in the garden. And then you might assign a certain sector that can work in the garden during that time period. And then moving on to another group coming in, given a half-hour break in between so that there's time for cleaning and sanitation to occur, which we'll talk about in a little while. And then you might have a third group and then your fourth group coming in. So these are ways that you can really enforce the social distancing and making sure that people are able to stay safe when they're working in the garden. So some more controls. So we all love our children, but children really need to be able to stay at the family plot. Sometimes kids are young and they need to run around. They have a lot of energy. So if it's difficult for them to stay at the family plot, then they should probably stay home. And if they're sick, they have to stay home. We'll talk more about people with illnesses in a little bit, but definitely leave them at home if they're sick. And try to limit no more than one adult and one child to the plot, or I try to say no more than 2 people in general to the plot, because again, we're trying to maintain that social distancing. So if we have a family of 6 come to work on one particular plot, then you may not be able to maintain that social distancing. The gardeners or volunteers and managers should be washing their hands before and after visiting the garden and working in the garden. You need to make sure that there's soap available, that there's potable water available, and single-use towels. The single-use towels can be paper towels, or it's okay to use a cloth towel as long as it's only used once, and then it goes into a bucket, and somebody takes responsibility for making sure that they're washed and sanitized properly. If you're using single-use paper towels, you need to have a trash bin, or if you're using cloth towels, then you need to have a bin to put those in as well, and it should be emptied regularly. And then you also want to do monitoring of hand washing facilities to make sure that they are cleaned and sanitized regularly and kept stocked. You should also be posting hand washing signs reminding gardeners that they need to wash their hands before and after visiting the garden, and anytime they may potentially become contaminated. And one of the most important things I wanted to emphasize is that when you're washing your hands, you're supposed to wash them for a minimum of 20 seconds. You want to scrub the palms, the backs of your hands, in between the fingers, under the fingernails, in your wrist. We always say that, you know, hand washing is one of the simplest things you can do to prevent spread of disease, but it's one of the things that people mess up the most. So 20 seconds, making sure you get all those surfaces scrubbed on your hands. Hand sanitizer is not a replacement for hand washing. It's not as effective as hand washing. So if your garden is going to make hand sanitizers available, these should be used as a secondary source after hand washing. And you should only use commercially produced sanitizers that contain at least 60% alcohol. Homemade sanitizers should not be used because it is unknown if they were made properly and if they contain the proper amount of alcohol required to kill organisms. With regard to gloves, each person should have their own gloves, and the gardener should not be coughing or sneezing into gloves. You're supposed to cough or sneeze into your elbow, and any gardeners that are ill should be excluded from the gardens. If they're coughing and sneezing, they should not be there. If a gardener is feeling ill, or even a volunteer manager, they should not go into the garden. Gloves need to be cleaned and sanitized before they're used, and then of course after they're used. And then gloves need to be changed if they become contaminated. So if somebody does happen to cough into their glove, they should change them, because you don't want them to then go and start touching other surfaces like the water spigot, for example, and then contaminating that surface where other people might potentially come in contact with the virus. Toileting facilities. These need to be regularly cleaned and sanitized. I know sometimes they're porta potty types, or they might be actual built facilities, but they need to be regularly cleaned and sanitized. Is really going to be dependent on the amount of usage, how often that needs to be done, but there should be a regular schedule in place, and I would say at least several times per day. In the previous slide, I gave an example of doing different shifts to maintain social distancing for when people can work in plots, and then having a break in between to do cleaning and sanitizing. So this would be a good time to make sure that the toileting facilities are cleaned and sanitized as well. If they cannot be regularly cleaned and sanitized, then they should be closed. And again, you want to do regular monitoring to make sure that that cleaning and sanitizing is taking place. People should not be eating or drinking in the garden, and food and beverages should be left either in the car or in an outside area external to the garden itself. I'm gonna give me just one moment here.
So can I go ahead and jump in with a couple questions
Yes,
that we've
that's what I
had
was,
so far?
yes, perfect.
Okay, great. So we've had a couple questions about how to think through having a visitor log and a sign-up sheet in a way that is sanitary. So, uh, I wanted to just point out that one suggestion could be to do an online Google document, again, using that type of system of having a layout for your garden and identifying certain times that are open for gardening. Another idea would be at the garden, if you have a log where people can actually log in, do not provide a pen, but ask people to bring their own pen to log in. And Stephanie, I'm wondering if you had any other suggestions for the creating a schedule and making sure that that's a sanitary situation.
Yeah, so I think the suggestions that you offered would be that those are the best. So, and then of course, you want your manager or your volunteer, whoever's managing the garden during that time period, to make sure that there aren't people coming in that haven't signed up, or that's not their time to do, to visit and work, not to visit, but to work in the garden. So I think the things that you mentioned are, those were the ones I would think of too, is to, have a logbook, or to like a Google document, or, some way to sign up. And then somebody's going to have to go in and review those to make sure that, there isn't going to be overlap or people working close together. And if there are, then you're going to have to make changes to the schedule and notify people of that if there's a problem with distancing.
And, building on that distancing comment that you just made, we have had a couple questions from people about limiting the number of the people in the garden to 10 at a time. And I'm just wondering if you could talk a little bit about both some of the rules that are implemented in states that are limiting the number of people that are together, and why that number should be minimized and monitored.
Right. So the state, so many of the states, it of course depends on where you live. So you want to check, the rules with regard to your particular state. But most of the states that have implemented social distancing measures, or municipalities, are saying less than 10 people. So even if the garden is somewhat large, you still need to be in compliance with that, because with those regulations, those laws that have been put into place by states and municipalities, where you're not having gatherings of more than 10 people. The other issue is that, when you do start having more people, it's harder to maintain that social distancing. So that's why those are being put into place, is to make sure that there's, plenty of room. As I mentioned in one of the earlier slides, they say that you should maintain distance of at least 6 feet. But, the further you can keep people away from each other, the better. So if you can spread that out to 20 feet, that would be even better.
Yes, and so it is really important to have some type of time schedule and a log for people entering the garden, and then some policies that people do report if they have gotten sick, because that's one of the times that you would want to use that log. We would be able to know who else was in the garden during that same time period, or close before or after that time period, so that you could notify the health department and make sure that you notify other gardeners.
Very true. That is correct.
Okay, we had one other question about how long the virus persists. And this question is, how long does the virus last in compost or in the soil?
That is unknown at this time. There's no data on that, unfortunately. So, you know, getting back to how long we know it lives on some surfaces, I mean, so far they're seeing, you know, up to 3 days potentially on surfaces, but you know, with regard to soil, we just really don't know.
Great, thank you. I think some of the other questions that have come in, we are going to be covering in the next session of the presentation. So let's go ahead and continue with your presentation, and then I'll follow up with some additional clarifying questions if we have those.
Fantastic. Okay, so we're going to move on now to talking more about surfaces, tools, harvest containers, you know, just kind of a broad overview of, you know, these different, at the end of the day, we're talking about different surfaces. So we'll move on to talking about that. Let's see, having a little bit of trouble with the slides advancing. There we go. So the virus may be spread through contact surfaces, as we've talked about. So the concern is that an ill person is going to touch the surface. You know, they've coughed into their hand. They're now touching, you know, a faucet, a hose, tools, you know, containers. And then somebody who's healthy comes along and touches that surface, you know, shortly thereafter, and then ends up touching their face. And then now they're infected with the virus. So although the risk appears to be low, there is a potential risk. And so prevention is going to be really important to reducing that risk. We want to try to get it as close to zero as possible. So some of the controls that we suggest putting into place is to leave the gates open if you have gates. That way, you know, people aren't constantly handling the latches on the gates. So when the garden's open, leave the gate open, and then when it's closed, you can go ahead and shut it. You want to post no visitor signs on gates and fences if you have gates and fences. If you do not have gates and fences, it's a good idea to use flags or some other types of means to try to define the garden perimeters and entrances, and then try to put up signs around those areas in whatever way you possibly can to let people know that it is closed to visitors and to the general public. You also want to make sure that you remove or cordon off benches, picnic tables, and play structures. So due to the pandemic, the garden's basically going to become an area where only work is performed and not an area to play or socialize or, you know, eat your meals. So we really want to just have people go in, do whatever work needs to be done, and then leave. And that way we can, you know, prevent or try to limit the number of interactions taking place in between people. You want to avoid or minimize contact with surfaces as much as possible. So, you know, any kind of surface. And so it's a good idea to require or encourage gardeners to bring their own tools and harvest bins. So that way you don't have to worry about, you know, somebody touching it that's potentially infected with the virus and potentially contaminating the surface, and then someone else coming in contact with it. Another thing you can do is to assign tools or specific tasks to individuals. So you might have somebody that's, you know, responsible for doing, you know, watering or using a particular tool. That way you're not having a lot of people coming in contact with different surfaces. You want to make sure that you're performing regular cleaning and sanitation of these different surfaces. So that can include things like if there's any doorknobs on outbuildings, padlocks, water spigots, gates, tools, harvest containers, anything that's going to be reusable like bins and buckets, and any other contact surfaces where there's going to be different people touching those surfaces on a regular basis. So with regard to proper cleaning and sanitizing, it's really a multi-step process. So these sanitizers slash disinfectants do not work well if a surface is heavily soiled. The reason for that is because the sanitizers will bind to the organic matter, and then that makes the sanitizer disinfectant less active and less able to kill the virus. So when you're doing proper cleaning and sanitizing or disinfecting, you want to first remove the dirt and debris and then apply a detergent, appropriate detergent, and scrub the surface, and then rinse it off before using the sanitizer or disinfectant. The EPA does have an extensive list of approved sanitizers against coronavirus available, and I've provided the link for that. I know some of you have not received copies of these slides yet, but Colette will be sending those out, and that link will be available. And you can also Google, EPA disinfectants for COVID, or just a general Google search, and that'll come up. The list is very, very extensive and hard to wade through, but there is a search option in there. So if you put in, for instance, Clorox wipes, it'll come up with a list of Clorox products, and that'll kind of help with the search. The other thing you can do is just make a simple bleach solution. So it's 5 tablespoons of bleach per gallon of water, or 4 teaspoons of bleach per quart of water. The recommendations for the bleach concentration to kill the virus is higher than what would normally be used for disinfecting and sanitation. Some other common sanitizers, hold on one second. I apologize for that. So other common sanitizers that can be used for disinfectants is alcohol, so ethanol or isopropyl rubbing alcohol with concentrations of 70% or greater. Some of the other common ones we see on the EPA list include like Clorox multi-surface cleaner and bleach, Clorox disinfecting wipes, or Lysol disinfecting wipes. There's a whole list there. I know a lot of these are hard to come by. Bleach is probably going to be the bleach solution I mentioned on the previous slide, is probably going to be the easiest one to make. It's going to be the cheapest, the cheapest one. I know bleach is kind of hard to come by too, but that's always a good option.
Stephanie, we have a couple questions about sanitizers and bleach in particular, so I thought I would just jump in and ask them. One question is, if you're using a bleach solution, how long is that solution viable?
Yeah, so that's a good question. So on the CDC recommendations, they don't specifically, state that with that particular concentrations, but generally speaking, those solutions should be changed at least daily. And I'd probably say, make new solutions every 4 hours, because you want to make sure it remains as active as possible.
Okay, great, thank you. Then we had a question, somebody was asking if they could use vinegar as a sanitizer.
No, you want to use something that is going to be effective against coronavirus. So you really need to use something off the EPA list, or the bleach solution.
Yes, and there's been several comments about how difficult it is to find bleach and other sanitizers. Yeah. And so, yes, you definitely would want to check that EPA list, because there are a lot of options listed there. And then one of the things that I've seen is that there are several community groups that are helping each other out. So they're Facebook groups, and I've seen that they're posting when sanitizers are available in local grocery stores. stores. So you might look and see if there's an option to be part of one of those communication lists to be up to date on when things are available. And then
Yeah.
if your garden can have some materials on site, that would be excellent.
The other thing too I want to state is, a lot of, for community gardens especially, I could see, you go to the grocery store and get bleach or get disinfecting wipes. That's the easiest option. Some of these other options that are listed on the EPA site are things that might be used more frequently in industry. And even though it might be more of a challenge to try to find out where you can get those, they might end up being easier to get. So that might be something to look into. I haven't actually tried to do that, but that might be another way to have a little more access to getting some of these disinfectants and sanitizers.
Then we have a couple of other questions, and one of it is, how effective are sanitizing sprays on wooden handles of tools or on different surfaces like plastic, bins, wooden handles, tile, countertops?
Yeah, so that's a great question. So basically, you know what, Colette, I'm going to move on to the next slide real quick, okay? And then I'm going to come
Okay,
back to that
great.
question. Let me see, because there's a couple of things I want to talk about with regard to these solutions. So with answering that question, you always want to follow the directions on the label. So, and we generally go after, if the label gives directions for sanitizing versus disinfecting, you want to use the directions for disinfecting a surface, okay? So I want to make that very clear. It's going to have a longer contact time. You also want to look at the label with regard to answering the question. You want to look at the label because there might be different contact times that are required depending on the different type of surface. So at the end of the day, it really comes down to reading the label and following the directions. The product, when it says that it needs to be in contact with a surface for a particular length of time, that means that that surface has to stay wet with the product. So if you use a Clorox wipe, for example, and it says to disinfect, you need to have it, it needs to remain on the surface for 4 minutes. That surface needs to remain wet with that product for 4 minutes. And again, it might have different contact time requirements depending on the type of surface. So, with viruses, they're not, growing, they're not, multiplying in numbers. So generally, they're going to be on the surface, whether it's wood or plastic. And if you're saturating the surface and keeping it wet for the length of time on the label, then it's going to be pretty effective for that, it disinfecting that surface.
Great, thank you. I think that covers a lot of the questions. We do have a couple that came through, and I think one is a clarifying question.
Okay.
So one of our viewers understood that the recommendation was to use commercial sanitizers only, and he happens to be looking at a page that gives recipes for homemade sanitizers. What would your recommendations be?
Do not use those. There's a lot of those that are floating around, do not contain the proper concentration of alcohol. For homemade sanitizers, there's a requirement of at least 60% ethanol or 70% isopropyl alcohol for them to be effective. And the measuring tools are not accurate. They end up getting diluted. I actually tried to make a few of them just to see how they turned out. So like there's the one you mix it with aloe vera. Well, by the time you add enough ethanol, it's essentially water, or yeah, enough ethanol is essentially water. And you can't possibly add as much, aloe vera as they say to make it more of like a gel-like solution. So do not use those. There is a recipe that's been published by the World Health Organization, but some of those ingredients are going to be difficult to get because they require making a mixture using at least 96% ethanol, with a final concentration of ethanol ends up being around 80%. And so for that, you need to have other things on hand like distilled water, peroxide, high concentration ethanol, and then and glycerol. So things that aren't necessarily easy to get, but you don't want to just take something off the internet because you can make a product that ends up being completely ineffective.
Okay, thank you. Two more questions I'd like to ask at this time. One is, what about hydrogen peroxide? Is that considered a sanitizer?
Yeah, it's a great question. So that's one I forgot to look on the EPA list if it's on there or not. There's been other studies that showing that 3% hydrogen peroxide is effective against coronavirus, against other coronaviruses. But I would stick with what's on the EPA, again, what's on the EPA list, sticking with those, because you want to make sure that it is effective against this particular coronavirus. So now that we have the EPA list out and available to everybody, then you want to make sure you stick with that to make sure that you're using something that's effective.
Thank you. And as you said, I just wanted to re-emphasize that these commercial sanitizers do say if they are approved for food contact surfaces. So if you are sanitizing things like your food harvest containers, you're going to want to make sure that you use a sanitizer that is approved for food contact surfaces and to follow those directions on the label.
Yeah, definitely.
We had
You don't
another...
want to poison yourself trying to sanitize or disinfect the surface. So.
Exactly. And then we had a really great question about bleach solution and whether it has a negative effect on garden soil, or should sanitizing be limited to a specific area? So would you like to talk about best practices for having a sanitizing area in the garden?
Yeah, I probably wouldn't just spray it, wherever of course, with different surfaces, and then, like hand washing or toileting facilities, you're going to have to clean those things in place. But for things like tools, it'd be okay to just have a certain area where you have access to water, you can use soap, you can use the disinfectant or, sanitizer, and making sure that, all that water, and soapy water and everything else doesn't get, in contact with the plants or accumulate into the soil and negatively affect plants. So it'd be good to have an area, set aside for doing that.
Great, thank you. One final sanitizing question, and people are asking how to sanitize different types of gloves. So there's cloth gloves, there's leather gloves, and with those sanitizing practices, should people be allowed to bring their own gloves to the garden, or should the garden be required to provide gloves that people would use?
Yes, we'll talk in the next, or as we finish up, we'll talk a little bit more about protocols. If the garden's going to provide gloves for people, then they need to be, single use for that day. So they need to be clean. Once somebody uses them, they need to go into a dirty bin where they can then be washed. So a lot of washing machines have like a sanitizing cycle where it uses, really hot water and steam to wash those. I know that that's not good for leather. And, for other types of gloves, it could cause the fabric to shrink. So that is a concern, but they do need to, be washed thoroughly in hot soapy water and dried. So, and making sure that only, one person uses that set of gloves. It is okay if gardeners bring their own gloves, but they have to, make sure that the gloves are clean before they come in. And, that should be part of the protocols and the policies of the garden. And that people, by gardening, they're agreeing to, abide by that, and that they're going to follow that. And then, yeah.
Great, thank you.
Yes.
So let's go ahead and continue with the presentation, and I'll work on synthesizing some of these other great questions that are coming in.
Wonderful, great. Okay, so I'm going to move on to talking about water sources now. So per the CDC, the virus has not been detected in drinking water. So basically conventional water treatment methods are using filtration and disinfection, and these can remove or inactivate the virus. I know that depending on where your garden's located, you might be using other sources like groundwater sources, for example, but where these aren't undergoing, filtration or disinfection. But right now, we're not concerned with water sources unless the water, source becomes contaminated. Somehow it's not a concern. However, getting back to talking about surfaces again, you do want to make sure that, the surfaces that are used for watering are being kept clean and disinfected or sanitized. So these are things like the hoses and spray nozzles, faucets, pails, watering cans. So you do want to make sure that if different people are having contact with these surfaces, that you are, doing cleaning and disinfecting, or cleaning and sanitizing. So you just want to do that using the procedures that we already went through, and using the EPA recommended disinfectants. And then, the frequency of doing that's really going to be dependent on usage. And again, another example might be, when to do that might be during those times in between when you have different people coming in to work in the garden. I'm going to go on now to talking a little bit more about protocols and training and communication. So some protocols that should be put into place, that you want in place for the garden is, what are the time of operations? When can people come to do the gardening, and what time does it close? And again, also making sure that you're managing the gardeners. So with social distancing, and then having those time periods in place as to when certain plots are open for doing work. You also want to have policies in place to make sure that people that are sick do not come into the garden to do work, and making sure that people are aware of those policies. So even if a gardener is feeling slightly, feeling a little coughy, have new cough, new sneezing, they should not be coming into the garden at all. And then you want to have either a manager or volunteer, again, being in charge, making sure that different policies and protocols are being followed and adhered to. And then also monitoring the facilities while they're there. So, knowing ahead of time, what is going to need to be monitored. Do we need to monitor the hand washing stations, the toileting facilities? Do we need to have a cleaning schedule for tools? Do we need to have, assign certain tools to certain individuals, or certain activities, certain individuals? So those are things that all should be put in place. You should have policies and protocols on those, and then have somebody to actually monitor when the garden's open and make sure that they're being followed. And then of course your cleaning and sanitation schedules are going to be part of that too. With training, you may want to hold an official training session to make sure that everyone's aware of these new policies and protocols put into place. So some of the times you might want to do this is before you open up the garden for the season. If you have, I wrote new visitors, that should say new gardeners coming. If you need to put reminders into place or if there's any changes in the policies. So this doesn't have to be, this big, huge training session with a lot of people. We're still trying to maintain social distancing and limit numbers. So you can, do it with small groups, that are with people at least 6 feet or more apart. You might have to do a lot of yelling for that, but you can also do it remotely or do it by email. And then you can even potentially use this training. This training will be available on the Cultivating Success website. So you could even use this as a training and then just add garden policies, your own garden policies at the end of the training. You want to make sure that you're communicating to gardeners and the public. So you want to let the public know that the garden's closed, that they're not to visit it, and that this is because, we're trying to maintain social distancing and maintain everyone's health. So you want to make sure you're using any resources that you have available. So whether you should definitely be using signs, but even using things like social media, newsletters, putting something in the newspaper, anything that's going to get the word out to let people know what the policies are and why these are in place. And then again, use your volunteers or garden management to make sure to give reminders to gardeners and make sure that any visitors are excluded from the garden area. Definitely post signs. Some of the signs that to be posted would be hand washing signs, visitor policies, which are no visitors allowed. That's the visitor policy. Gardener policies that they need to be aware of. Reminders for social distancing, making sure that people, gardeners do not come into the garden if they're sick. Potentially use of mask, which I somehow skipped over that slide. So there's a new CDC recommendation, I'll talk about that right now, about the use of masks, of cloth masks. That might be something that you want to implement in the garden. They do recommend the use of cloth masks where social distancing is difficult to maintain. If you're, properly spreading people out, then it should be easy to maintain social distancing, right? But, the use of mask is an option. If you're going to require them in the garden, then people should be aware of that. And then, any other policies, that are going to be really important to maintaining safety, you want to have signs for those. And some places where these need to be posted are like near entrances, water sources, storage areas, and definitely if you have policies for a particular area or for tools, for example, if the tools are stored in a storage area, you want to make sure that those policies are posted by that area. You want to make sure that gardeners are understanding the policies and understand that those policies are for their own safety. And another thing that would be good to do is if you are posting signs, to try to post them in different languages, because you might have a diverse group of gardeners coming in, and you want to make sure that they're aware of your policies too. You can also do email or print or request confirmation. So you can email out a list of the policies and tell people, in order to use the garden, you need to, reply back that you have read through the policies, that you understand them, and that you're going to abide by the policies. And then you need to be prepared that to put, ramifications in place if people aren't adhering to them. So that would be a good thing to decide ahead of time. So if somebody comes to the garden and they're obviously sick, then they need to be removed from the garden, and there probably needs to be some cleaning and disinfecting taking place, right? Depending on what they've come in contact with. And if they do it repeatedly, then maybe they are not allowed to garden there anymore. So those are things that are difficult, but you should be prepared to do that. Again, we're trying to make sure that everyone is able to stay healthy. So again, do not go to the garden if they're sick. Gardeners should have a backup person to do tasks in case they do get sick or they're not feeling well. And then it would be good for either the volunteers or the managers to have a list of potential backup people so that they know, okay, this is this person's time, they're not coming because they're not well, and this is their backup person who's here in their place. So you want this person to also be aware of the policies and to be authorized by whoever's in charge of managing the garden to go in there. So again, you want them to know that these are the policies and the requirements for doing work in the garden. Okay, produce protocols. So we're going to keep this really simple. So you want to harvest produce into a container that's been cleaned and sanitized, disinfected, and it's best if everybody has their own personal container. So to do this, so it's best if you request people to bring their own containers. Once they have harvested the produce, they need to take it home to do the washing and cleaning. So you don't want those sorts of activities going on in the garden. We're trying to reduce the amount of time that people are spending in the garden and try to increase, the social distancing. So have them take the produce and go home to wash and clean it. If the produce is going to be donated, then just pick it in the in the field, in the garden, and then bring it to the donation facility as is. Or you can also ask the donation facility what their policies generally are for receiving donated produce. So be sure to check with them as well. But generally speaking, you just want to pick it in the field and then bring it directly to the donation facility. Okay, so take home messages. This is a lot of information. These are scary times. But, we really need to make sure that controls are in place and implemented to ensure safety. If they cannot be implemented, then the best thing to do might be to just do a temporary closure, okay? This, no pandemic in the history of the world has lasted forever. So that's the good news. This too will pass. Again, they're hoping things will slow down by June. We don't know. It's gonna depend on, what happens over the next couple of months. But, it is temporary. And so keep that in mind. And also look for other options. If you do, whether you have to close the garden or not, you can still encourage and support individual gardening and provide support for that. Encourage people to do container gardens. Even if somebody just has a small patio, they can still grow a lot of food in containers. Provide your expertise and assistance to people. You can, if you do close the garden, you can always do a delayed opening after the pandemic passes and things have returned back to normal. And, given that if there's a delayed opening, you might have to alter the crops that are growing during the year. So you might have to do stuff that grows a lot quicker and not do, something that takes, 120 days, right? But, those are all options. And then, oops, sorry about that. So, there are a lot of different things that you can do. There's a lot of information and resources available. So I've listed some of the different resources here. So we have a food safety page that has a lot of different COVID-19 resources. A lot of the information that we've covered today is available on both that website, and then also there's one out by Purdue that's a good resource. Of course, CDC, it should be one of your, either CDC or your local health department should be your primary source of local and state information. And then FDA has a lot of great resources. And of course, your extension office is always here to help you. That's why we're here. We're more than happy to help you in any way we can. So don't be afraid to reach out to us.
Thank you, Stephanie.
Questions? Yes, thank you.
Yes, we do have some more questions, and so I will try to summarize them again. And we thank everyone who has stayed on the webinar past our 12 o'clock hour. So we will take a few more minutes to talk about best practices in the garden. So one of the questions that we've received is, if we do not have a hand washing option in the garden, do we need to close the garden? And so I'm going to ask you to answer that question, Stephanie. And then I do want to tell folks that once we're done with this Q&A session, I will show you a slide from another presentation that we had on a different webinar that will show you a really simple do-it-yourself hand washing station that you could put in the garden. But if there is not a hand washing station and one cannot be provided, Stephanie, what would you recommend as the best practice for the garden?
At that point, I would probably recommend doing a temporary closure, because hand washing is pretty vital during these times. And then getting back to what Colette said, is that there are a lot of options for providing hand washing facilities. They don't need to be extravagant and expensive. And I'll let her show you the one that that she's familiar with, but they can even be different, something like a giant with it though, like a water coolers, with some soap. You just want to make sure, if you're using something like that that doesn't have a drain, that you have a catchment basin of some sort, like a bucket, so that that dirty water is not just running into the growing, where you're growing produce. So you want to have some sort of bucket to contain the dirty hand washing water that can go be disposed of somewhere else. And then the only other issue with that is just if you are dumping that water, you need to know where it can be dumped at safely without being in violation of any other laws, right? So that's a concern too. But there are a lot of different options for providing hand washing, doing simple hand washing station setups. And Colette, maybe we could provide some other resources online, do you think, on the Cultivating Success website?
Yes, we can do that. And we'll definitely point you to some other webinars that we have. We have a webinar posted called Worker Health and Hygiene, and that is a really good webinar that talks about hand washing. And we'll put some links to some other materials around hand washing stations. One of the other questions that's come through, or comments, is that people are concerned about the ability to actually clean and sanitize tools. And it may be that you need to require gardeners to bring their own tools to the garden. And that might be a temporary thing that you have to do and not have shared tools. Again, if people are wearing gloves, the virus has a relatively short life on all surfaces. And so making sure that hand washing is happening, people are not touching their eyes and their nose and their mouth, making sure that if people are ill, they're not in the garden. using disposable gloves is a great option. And we had a question about disposable gloves. Stephanie, one person asked, can they wash their latex or nitrile gloves, like you're washing your hands with soap and water and then reuse them?
So gloves are supposed to be those types of gloves are supposed to be single use, and with washing and, trying to disinfect them or wash them, and then reusing them, the materials can start breaking down. So then that kind of reduces the barrier, and you're potentially more likely to start getting, tears in them, and things like that. So, they should just be used, and then discarded after use.
Okay, great. Thank you. I'm just going to go ahead and take a couple more questions. And so
Sure.
another one is, somebody asks, what temperature is really hot? So when you're thinking about, quote, really hot, what does that mean? And
That's a
can
good
you,
question.
well, and then, so I think when you're thinking about washing gloves, we think about really hot. But then the other question we got was, we only have cold water in the garden. Can we use that for cleaning and sanitizing water, and can we use it for hand washing water?
Um, those are all great questions. So there's a lot of different ways to look at this. So first of all, with regard to, washing gloves, and I say, hot water, whether you're using reusable towels or not single-use towels that will be washed and then brought back to the garden and used by one person. When or gloves, when you're running them through the washing machine, you want to use the hot water cycle, and then if you have a sanitizing step on your washing machine, to use that. So I know most home water heaters are like what at 120 degrees Fahrenheit, sometimes hotter. So I would say at least 120, and a lot of times different washing machines will actually heat up the water higher, especially if it has like a sanitizing cycle. So just use the hot water cycle. We're trying to do as best as we can with what we have. And then Colette, what was the second part of the question again? I apologize. I skipped my mind.
It was talking, the question was, can we use cold water for hand washing and for the washing of tools and equipment before we sanitize?
Yeah. Okay, so it's better to use warmer hot water, but if all you have is cold water, it's okay to use it. It's better than not cleaning and sanitizing it all, right? So, or cleaning, disinfecting it at all. So, if you have a warm water source, it's preferable to use that. With regard to hand washing, one of the concerns with using cold water is that if it's too cold, people are not going to want to wash their hands for the minimum of 20 seconds, right? So, we always tell people that with regard to hand washing water, that you want it to be a comfortable temperature, so that people are more inclined to wash their hands for the required length of time to ensure proper hand washing. So one thing to know is a lot of the that's going to be important to know, though, with regard to that, is that first of all, a lot of the soaps don't work as well in cold water. You might have to use more soap, and so those are things to be aware of. And then also with some of the sanitizers and disinfectants, getting back to what it says on the label. If it's something that you have to mix, then you need to use it at the temperature that the label states, or it may not be effective. So some of these, sanitizers or disinfectants may not work in cold water, or may not work well in cold water. So that's something that you're going to have to take into consideration. So, you know, I'm not saying it's not possible, but you know, that's one of the challenges. So, you know, do your best, try to use a sanitizer. If you only have cold water, use a sanitizer slash disinfectant that will, you know, work with cold water. You know, make sure you use enough soap to scrub, you know, if you're using cold water.
Great, thank you. Well, we are past our time today, so I want to really thank you for your presentation, Stephanie, and to let people know that we will go through the questions that were asked today and make sure that we have resources posted where we're posting the recording for this webinar and the slides from this webinar to help you find the information that you need. So I'm going to go ahead and share my slide. And that shows you a hand washing station. So you should see now the do-it-yourself hand washing station. And so you can see here that this is a hand washing station that would cost about $32 to create. So it simply has a 7-gallon jug with a closed valve. You don't want to have a pump valve. It's definitely important to have one that you can turn off and on. So when you turn it off, you're using your paper towel. Using the single-use paper towels, as Stephanie said, soap, having a catch bucket, which you see down here, and bungee cords to hold it onto your surface so it's stable. So think through that, you will want to have your trash receptacle there. You want to have signage that tells people on how they should properly wash their hands, definitely following those CDC guidelines. And we'll make sure that there's some PDFs of some signs that you could post at your garden in that resource page as well. So with that, I'm just going to tell you where you can find these webinars. And Stephanie, I just want to check in that my screen's showing correctly and you see the Cultivating Success webpage right now.
Yes, I can
Okay.
see that.
Okay, great. So here's where your landing site where you're going to be able to find the recorded webinars under this tab. And again, we'll put additional resources up there, and we have a tab for upcoming webinars. I also wanted to let you know that from our website, you can sign up for our newsletter. This is, generally speaking, a bi-monthly newsletter that comes out 2 Wednesdays a month. During this time of COVID-19, we are sending some updates pretty much on a weekly time schedule to be able to let people know about different webinars or educational resources that have come out in that week or would be coming up the next week. Things are changing so rapidly that we're trying to be really current with them, with that information, but also mindful not to put too much information in your inbox. So if you'd like to sign up for our newsletter and get those in dates, you can do that, updates, you can do that from our website. We have some upcoming webinars in this series. So next week, we're going to have a webinar on best practices for farmers markets and farm stands during COVID-19. Faith Kreitzer from Washington State University, who is also a specialist in food safety, will be our lead presenter for that webinar. Then we've had some questions about how to start a CSA or a farm subscription program. So we will have a webinar on Tuesday, April 12th about the fundamentals of a CSA, and that's going to be at 11 o'clock a.m. And then at 1 o'clock p.m., we'll have a best practices for farm deliveries, pickup, and CSAs related specifically to COVID-19. Again, you can
Colette,
register for, yes?
sorry to interrupt you. I think the one on April 12th, I think that's the wrong date for
Oh,
that.
you are right. Sorry, it's April 14th.
It's April 21st for
April
both of them.
21st, yes.
Oh,
So
you're right.
the one for CSAs, the two that say Tuesday, April 12th, those are both on the 21st.
Thank you. Sorry,
Yes.
I typed those in backwards. So you can register for those on the website. We have a quick survey that is our post-webinar evaluation that's going to launch in your browser when we close the webinar today, and we would really appreciate your taking a couple minutes to provide feedback in that survey. And one of the questions that we are asking is, what other resources or information do you need? So with that, I want to thank you all very much for joining us today, and we hope to see you on one of our other webinars. Please be well and stay safe. Thank you.
Thank you.